I'm here with Dr. Ed Zebovitz. He's a TMJ surgeon and an oral surgeon out of Annapolis, Maryland. And he is one of our CNO SS speakers. He's also on the CNO Board of Advisors. Ed, what do you think of the symposium?
So, hey, Nick. Well, thank you for allowing me to be a part of that and bringing me into the fold. It's so exciting. The symposiums bring together just great minds and allowing, I think, again, most of our problems very rarely do we ever have just one problem.
Yeah.
So the thought is with our patients, as we identify, the more we know, the more we see, and subsequently we can do just better, more comprehensive care of our patients. So with the speakers you have lined up, I mean, just again, exciting in that we're going to hear people talk about radiology, we're going to hear about infectious disease, we're going to look at kind of things that probably aren't on the forefront of our daily work, but impact what we do. So in understanding that and understanding it in a way that we can apply it and into our skills to our care of our patients, I mean, that's the key. And ultimately, as we continue to learn, what we learn today will help us learn more tomorrow, and that's just cumulative. So I'm excited. I think the symposium is going to be just a great way for people to just raise their awareness and ultimately improve our care to our patients and making sure that we're caring for them. And then
Sure.
ultimately, too, is getting them to the place where they need to be. So
Yeah.
we can be great facilitators, and it may not be something that we do specifically, but getting connected with a network of people that have people that do what we need them to do, then great network. And again, this is making a community so that those patients have resources as well. We have resources as practitioners. So
Yeah.
just
The
excited.
whole point of the CNO is to form a network to where it doesn't matter if we're a specialist or a general dentist, an orthodontist, an oral surgeon, we can all speak the same language and do what's best for the patient. And you and I just finished, or actually it was you, we just finished filming your airway surgery. The slides are still up on the screen. And in the airway, you and I are doing a neural occlusion screening lecture, and you also independently just now did the airway lecture. Briefly, can you tell them what the airway lecture was about?
And so as it seems to be kind of a hot topic, but more so, well, hot topic, and maybe I should say deserves to be a hot topic, because when we think about breathing, we think about, sleep apnea as people that are snoring. What I'd like to say is it's less about that and more about general health and really focusing in on cardiovascular issues, all the medical implications of it besides the subjective sides that we look at.
Yeah.
What CNO's done and what really evaluating this is really brings in as many objective measures as possible so that we can really document where the problem exists, create targeted approaches to managing their problems and managing their complete problems. So with airway, uh, the overlay of airway on temporomandibular joint disorders, muscular order, things, and then again the medical side of cardiovascular, respiratory, uh, metabolic disorders, just showing that it touches on so many aspects. So as we start to understand how dots connect, or how our systems, physiologic and pathologic, uh, interplay, again, one more way that we're better. So looking at airway, and then less about treating snoring, more about treating how do we make somebody overall healthier.
Yeah.
So, and not for today, but also for down the road, 20, 30, 40 years. So
Let me ask you one quick question. A lot of dentists will argue that the airway angle is kind of not really our purview or not really pertinent because most people are designed to breathe through their nose, not their mouth. What do you say to that?
So, thank you. I would say one is it's definitely in our purview, and because we handle the front door of the airway, either air comes in through the nose, air comes in through the mouth. And looking at some of the modalities that we have available, our orthodontics colleagues have been doing it in adolescents for forever, that we also can help our adults with.
Yep.
So how do we make them better nose breathers, which better for parasympathetic nervous system, better for calming effect, better for filtering air, better for our respiratory tract, and then also, make sure that they're good mouth and nose breathers. So all of these things, the front door talks about the size of the oral cavity, the position of the oral cavity, how much room we have for a tongue, and ultimately how that affects the airway posterior to the tongue. All these things are right in our front yard, not our backyard, in our front yard of treatment.
Yeah.
But just understanding how we can identify it ultimately, whether it's ourselves or have a network of people to be able, network of practitioners that can work in an interdisciplinary way to care for these patients.
That's the whole point of the symposium, getting us all to talk to one another and learn from one another.
Correct. And
And
use
thank
the
you very much,
language.
man. Yeah, the same
Thank you,
language.
Nick.
Thank you. All
All
right.
right.
Take care.
Thanks, Nick.